Behavioral health services has always been a part of El Camino Hospital from the beginning. Today, we have an inpatient psychiatric unit as well as extensive outpatient programs. One program where patients can be treated on an inpatient or outpatient basis is the Electroconvulsive Therapy program.
Electroconvulsive therapy is also known as ECT. It's been around a long time. It was first developed in 1938 as a treatment for mental health conditions used for a variety of conditions. We've provided ECT treatments here at El Camino Hospital since 1961 when the facility first opened up. Well, electroconvulsive therapy is the electrical stimulation of the brain. It's via electrodes that are attached to the head of the patient in order to induce a safe seizure. The procedure is performed by a trained psychiatrist. The patient's under general anesthesia throughout the treatment. ECT is utilized for treatment of depression, for bipolar disorder, and also less commonly for schizophrenia. Well, ECT is not a first-line treatment. Patients who are considered for the treatment include patients who have failed medication trials and psychotherapy. They may not be able to tolerate medications for their condition, and they have severe symptoms for which ECT can be effective. Electroconvulsive therapy may not work for every patient. There are some common transitory, short-term side effects that can be alleviated. These include headaches, muscle aches, nausea, confusion shortly after the treatment is common. Really, the most bothersome side effect is memory loss that the patient can experience. Follow-up data indicates that almost all patients are back to their normal baseline after 6 months in terms of memory. Some patients may have some persistent memory difficulties. This is usually be memory loss related to the events that are leading up to the patient receiving ECT. Well, electroconvulsive therapy is really a treatment series. It's broken into two different segments. The acute series is 3 times a week, an average of 12 to 15 treatments. Some patients require less than this, some patients require a little bit more. This is followed by a maintenance phase, which is a slow tapering of treatments to prevent the relapse of symptoms. Before a series of electroconvulsive therapy has been started, patients will have typically exhausted other therapies, such as medication, psychotherapy. They continue to have profound symptoms. Electroconvulsive therapy is the fastest and the most effective therapy when other treatments have failed. For many of our patients, electroconvulsive therapy has been a life changer, a savior when nothing else has seemed to work. They've been very grateful for what ECT has provided, a chance to live life again, enjoy the things that they used to enjoy before the symptoms of their illness took over. They've expressed in art and in poetry what this has meant for them.
Awakening. Morning, joyous. I imagine a wide silver ribbon stretched across the eastern sky. Pull on it once, hard. Expose a luminescent day given without condition. Messenger of what light can do inside you against the long darkness, the mock night you were in, eyes closed tightly for so long. Open your eyes into all the light of a first day, waiting patiently along the bobbing sea, along a glistening band of tomorrow and tomorrow.